Well, for the first time in 25 years, the U.S. is on the verge of losing its measles elimination status. So with more than 1,700 cases all across the country, health experts are warning this is a sign more old world diseases could pop back up. 3 people have already died this year, 2 girls in Texas and an adult in New Mexico. Measles is a highly contagious disease causing symptoms like high fever, cough, running nose, and a very distinctive rash. Those infected can at times develop pneumonia, leading in some cases to death. Joining us now, Dr. Omer Awan, physician, senior public health contributor with Forbes. Dr. Awan, thank you for your time this morning. So we have now reportedly more than 1,700 measles cases confirmed in the U.S. These are the highest numbers in more than 3 decades. There are questions about our status now. What is that critical point? Have we arrived?
Thanks for having me, Kelly. It's very critical and it's deeply concerning because, as you stated, there are nearly 1,800 actually cases of measles now throughout America, and we're at very high risk for losing our World Health Organization elimination status. That's a status that can be lost if there's been persistent infection for a whole year. And now it's been almost 10 and a half months where we've had persistent measles infections dating back to January, if you remember. And that means that if for more than 6 or 7 weeks, if we continue to have measles infection, we will lose that status. And that's a status that we've had since the year 2000. So we're talking about 25 years of having elimination status. And that's deeply troubling because this is a disease that's entirely preventable through vaccination. And the reason for all these cases and the surges is because parents are deciding not to vaccinate their kids against measles. So the message here really is for parents to please vaccinate your kids against measles because, as you stated, Kelly, it's a very serious disease and it can lead to death even.
I do want to dive into what some of the concerns are, why we're seeing these new trends, but also I want to hit on the spread because there was a doctor on another network noting that a case of measles can spark all of this turns into wildfire because the spread happens so rapidly. Would you mind describing how quickly this disease can move from one person to another?
Oh, very fast, because measles is literally one of the most contagious diseases that is out there in the environment. So if you have measles that's circulating in a room, for example, let's say somebody who's infected coughs or sneezes, even if they leave that room, that measles will be active for 2 hours and it can still infect other people, even if that person has left, 2 hours ago. That's a serious deal. I mean, if there are 10 unvaccinated individuals sitting in a room next to somebody that's vaccinated, chances are 9 out of 10 of those will get measles. That's not something that we see in many other diseases. Measles is a completely different virus and it can spread rapidly and it's an airborne disease. And if you're close to somebody with measles, they cough or sneeze, you can inhale those virus particles and you can become infected. Very contagious, which is why, again, it's so critical that we take precautions to try and mitigate its spread.
And we hear from professionals like yourself time and time again, vaccinations, they're the key. You have to get your children vaccinated, vaccinate yourself. What are the biggest items that make parents hesitant about their children receiving this vaccine? What do you hear?
Well, I think, Kelly, there's a lot of misinformation out there about vaccines. Oftentimes, we see on federal websites that, vaccines may or may not be linked to autism. That scares people, and understandably so. That scares parents, and they're not sure and they're confused about whether to vaccinate their children. But the proof is really in the pudding and the data, Kelly. And I think that when you take a look at the cases, for example, of measles, 92% of the cases of measles are in unvaccinated individuals or people whose vaccination status is unknown. And certainly the people that have died, we're talking about people, the 2 people in Texas, the 1 in New Mexico, were unvaccinated. So that should be enough proof to people that we need to get vaccinated. And, vaccines have been studied for a long period of time. They're known to be safe and effective. And I hope that gives parents some solace about getting vaccinated and why it's so critical that they do get vaccinated.
Well, it is heartbreaking because parents just want the best for their children. So what is your message to parents who have real concerns about wanting to do the right thing receiving some mixed messaging or, just in general, distrusting public health officials based on prior experiences?
I would say talk to your doctor. Talk to your pediatrician. Your pediatrician is the one that has likely the best interest in mind for your child. And I can assure you that the vast majority of pediatricians, if not all of them, will tell you to get your child vaccinated. And this is why trust is so important. And this is why, talking to the right people is so important. And again, the data is very clear. You take a look at the people that are getting infected, they're unvaccinated people. The people that are unfortunately dying, which is heartbreaking and tragic, as you pointed out, are unvaccinated. So that is my message. My message is to get vaccinated and listen to your pediatrician.
Yeah, do your research, get with somebody who you can trust. Dr. Awan, important awareness here. Thank you.